Hello and welcome you all to our channel Pharma Guru. Today we are going to discuss about the most important subject, pharmacology second, which is a part of B Pharm fifth semester, basically a third year. So today we are going to discuss about the unit first. In this we have some objectives over here. You can clearly see what are the objectives. So let's discuss about this. Describe the pharmacology of the histamine and enumerates its related drugs. So basically in this sections we have to discuss about the histamine, antihistaminic drugs or H1 receptor. Classify histamine 1 H1 antagonist. Discuss the pharmacology of H1 antihistaminic with the emphasis on the clinical uses, adverse drug reactions and interactions. So all the things are covered in this video, so watch it full. This will absolutely help you. So let's move on. What are autocoids? Before moving forward, we have to know about autocoids. If you know about autocoids, uh, you can clearly understood about the histamine. So what is autocoid? Autocoid consists of two Greek words. Autos means self or echoes means remedy. So self remedy. Autocoids means self remedy. Second point, secreted locally to increase or decrease the activity of nearby cells, which means this is secreted locally, which increase or decrease the activity of nearby cell. Third point includes, or what does the autocoids have or includes? Amine autocoids, which have histamine and serotonin, and here we have to mostly discuss about the histamine. Lipid derivatives, or sorry, derived prostaglandins and leukotrienes, peptides, bradykinins and angiotensin and other cytokinins. So here histamine present mostly in mast cell. uh, as you can see here, histamine mostly present in mast cell, which is skin, lung, GIT mucosa, or non-mast cell histamine, which is brain, gastric mucosa, etc. So let's erase this. So if we see the structure of the histamine, it consists two nitrogen or a simply a imidazole ring. If you see this is a imidazole ring. Okay, this is a imidazole ring. This is a imidazole ring. There is a two nitrogen over there with one gapping of carbon. So this is basically a imidazole ring and a ethylene bridge here, CH2 or CH, and a amine. So this is the structure of the histamine. So histamine is a biogenic amine. Histamine is a biogenic amine present in many animal and plant tissue. Okay, so let's move on forward. Wait, one second. Let me erase first. Okay, here synthesis of histamine. How we can synthesize the histamine? It is very simple to synthesize histamine. We can use histidine as a precursor to produce histamine or to synthesize histamine. Here, wait a second. Here, you can clearly see that there is a histone which we use as a precursor. Okay, and in the presence of L-histidine decarboxylase, which is an enzyme, and the main function of this enzyme L-histidine decarboxylase is to remove that CO2 from here and convert it into histamine. If you compare both the structures, there is only one change. You can see that there is no change in the ring. It is constant, but CS2 is also constant. CS2 is also constant, and S2 is also constant. So the main thing which is removed from here is this carboxylic acid. Okay, so CO2 is removed as a byproduct because it is a decarboxylase, or decarboxylase means it is a enzyme to remove uh, carbon dioxide. Okay, so this is all about this. Or we can see, if we can see the definition over there, the synthesis of decarboxylation, synthesized by decarboxylation of amino acid histidine, है ना? Amino acid histidine, which means if we decarboxylate the histidine, we can find our histamine. Okay, we can find our histamine. Let's move forward. Wait a second. Here we have to see that histamine is released from where? What is the source of histamine? From where it secretes or releases? So it is a immunological or immunologic type 1 reactions, mechanical releases, morphines, succinyl choline, D-tuberculin, and dextran. So if we look at this structure, we clearly understand how histamine released. So you can say take it uh, as your best part of the note. Okay, let's move forward. This is histamine about the histamine receptor. Here you can see about the H1 receptor, or basically histamine receptor is of four types. Four types. First one is H1 receptor. Second one is S2 receptor. Third one is S3 receptor, and the fourth one is H4 receptors. Okay. Here H1 receptor increases calcium ions. H2 receptor increases CMP or cyclic AMP, है ना? uh, Third one is S3 receptor or presynaptic auto receptor. It decreases cyclic AMP, and H4 receptor also decreases cyclic AMP. Okay. Uh, so here are some uh, basic information regarding receptors. For example, H1 receptor has a smooth muscle contraction or increased permeability in vasodilation, sensory nerve ending pain, or itching. Okay, basically smooth muscle, vesicular or endothelium, and brain. So it works or found in smooth muscles, vesicular, endothelium, and brain. It mainly founds in smooth muscles, vesicular, endothelium, and brains. So if we Go to the next one, H2 receptor. Here, gastric acid secretion, blood vessels increases. Okay, vasodilation, increase capillary permeability. So this is a basic function of H2 receptor. Okay. So where does the H2 receptor present in? Sorry, 1 minute. In gastric parietal cell, cardiac muscles, brain, and heart. Move on to the third one, H3 receptor. Here, histamine release decreases, secretion decreases, vasodilation decreases. It mainly found in CNS and some peripheral nerves. For fourth one or last one is H4 receptor. It mainly present in hematopoietic cells and gastric mucosa. Okay, hematopoietic cells and gastric mucosa. Wait a minute. Okay, let's move. Action of histamine. Action of histamine. H1 or H2. Basically, we have to see about the H1 receptor and the H2 receptor, or the action of the H1 and the H2 receptor. Here, the first point is arterioles and the post capillary venules dilation and decrease BP. Second, increased capillary permeability. Third, heart, increased HR or heart rate and force of contraction. और ठीक है. Okay, third one, triple response. Fourth one, severe hypersensitivity reactions. uh, if we talk about the adverse effects of the histamine, it is very dangerous. First one is itching. You feel itching when you suffer from histamine deficiency, and or adverse effects of histamine release: itching, flushing, hypotension, tachycardia. Or tachycardia means increase of heart rate, bronchospasm, angioedema, wakefulness, increased acidity or gastric acid secretion, or basically acidity. Okay, move on to the third one. Next one, beta histine. No. Okay, this is the important one. Classification of antihistamine. Next, ठीक है, first generation and second generation. First generation include this drug and second generation include these drugs. So you can take the screenshot, or you can write down it in your notes. It will surely help you in examination. Let's move on forward. Oh, one minute, please. Let me erase this first. Okay, so and H1 antihistaminic or first generation is marked potential for producing sedation. First generation, these are the drugs and used to treat the motion sickness. These are the drugs. Okay, so move forward. Second generation, these are the drugs belonging second generation. What are the therapeutic uses? What are the therapeutic uses of histamine? The first one is allergic diseases. In allergic diseases. Okay, the second one is in antiemetic motion, sickness, morning sickness, insomnia, cough, Parkinsonism, actual muscle dystonia, vertigo, and all that. Next, here is uses of second generation. No. Drug interactions. There are some drugs which interact with the histamine and produce some adverse effects. Mechanism of action: general formula of H1 blocker, competitive antagonist. Okay, so here we end up this video. If you like this video lecture, or it is it useful for you, so please like this video and subscribe our channel. It will surely motivate us to make this type of video again and again. Thank you very much. Tata, bye bye, see you.